Welcome to Wilderness First Aid. This is the first of two online videos that I'm going to have you watch. This one is just an introductory on getting started with Wilderness First Aid. You'll watch this and then you'll take a little quiz, and then I'll have you move on to the next one, which is assessment. And by doing that, we'll be able to have more time in the field after the class. So preparing to help. So it's always tricky whenever we have to make the decision to help, and this class is going to address the unique challenges of people that become ill or injured in a remote location. So unlike a regular first aid class where ambulances and hospitals are nearby, we're now talking about a situation where it may be a long time before you can get professional medical help. So that's what this class is about. After completing this lesson, you should be able to define what Wilderness First Aid is and the difference between Wilderness First Aid and standard first aid. So first aid is the immediate care given to a sudden injury or illness until medical professionals can assume responsibility. Standard first aid relies heavily on the fact that professional help is only minutes away. Wilderness First Aid expects that professional help will be significantly delayed. So, it takes into account that there's limited access to medical supplies, exposure to outdoor elements, and extended response time. One of the focal points of Wilderness First Aid is the need to provide extended medical care. Medical emergencies that are rarely never seen in an urban setting can more easily occur in the wilderness. All kinds of different examples of that. We all know from being out, from doing search and rescue or being out and hiking, that there's a lot of other things that can happen out there on the trail that just won't happen in an urban setting. The need to evacuate ill or injured people is an issue that that we're going to have to address. So, what Wilderness First Aid is intended to do is to preserve life, alleviate suffering, prevent further illness or injury, and promote recovery. So, Wilderness First Aid provider is someone who's prepared to deal with the immediate care of a suddenly ill or injured person and manage the issues created by being in a remote area. So, this course, Wilderness First Aid, provides the knowledge necessary to manage medical emergencies in a remote location. It includes a significant amount of time practicing hands-on exercises. That is what we're going to do on the Sunday of the course. Designed to meet the Wilderness First Aid Curriculum and Doctrine Guides of 2017, established by the Boy Scouts of America. So what are some issues addressed in training to become a Wilderness First Aid provider that are not typically included in standard first aid training? Basically, the fact that you're going to have limited equipment and that you're going to have a longer response time. Caring for somebody in a medical emergency could expose you to infectious disease. After completing this lesson, you should be able to state or identify the following: the importance of establishing a safe scene. And while the risk of contracting a disease is very low, it is wise to take simple measures to avoid exposure in the first place. Wear your medical gloves, wear your safety glasses. First aid in a remote setting usually involves extended first aid treatment time and substantially increases the risk of disease exposure. Infectious bloodborne diseases and pathogens include hepatitis B, hepatitis C, HIV, which is a virus that causes AIDS. Exposure to infectious bloodborne diseases can occur through direct contact with an open wound or sore, absorption through the membranes of the mouth, nose, and eyes, a skin puncture with a contaminated object. You just never know. Torn cuticles leave an exposed area. So wear the gloves, wear the safety glasses, do the best you can to avoid blood splatter in your facial area. Minimizing your risk of exposure lowers the risk to infection. Standard precautions is a set of protective practices used to prevent the transmission of disease, whether or not an infection is suspected. To be effective, your approach has to be the same every single time, regardless of the relationship you have with the subject or their age. Just because you know them doesn't necessarily mean that they don't have a condition that you are unaware of. Just because they're young doesn't mean that they don't have hepatitis B or C or HIV. Personal protective equipment, PPE, describes protective barriers worn to prevent exposure to infectious diseases. Gloves, safety glasses, and in some cases, a face mask. Disposable non-latex gloves are the most commonly used protective barrier. Always use them when providing first aid. If gloves are unavailable or damaged, improvise protective barriers with materials on hand such as plastic bags. Another common PPE is a face shield. It can prevent mouth, nose, and eye exposure when there's a possibility of splashing or spraying. All right, so here they're talking about removing the gloves. And so what you want to do, we practice this all the time, but at the wrist, you'll be able to bend your wrist and create a little pocket that you can reach in with the thumb and forefinger of the other hand and pull that glove inside out. Now the inside of the glove is clean, and you can use that to pinch the other glove or slide your fingers under the second glove and turn it inside out as well. We'll practice that with an exercise in the class. So with contaminated gloves, same deal. And they just show you the 4 steps there. All right, while you should always protect yourself from exposure to blood or other potentially infectious body fluids when providing first aid care, why is it particularly important to take precautions when providing care in a remote setting? Because you're going to be exposed for a longer period of time, because you're going to have a longer care period while you're waiting for professional medical assistance to get there. So they talk about the extended stay and the treatments can be more involved. So you may be exposed more than you normally would. All right, some legal considerations for you. You have to be aware of as a wilderness first aid provider. So after the completion of this lesson, you should be able to identify the following: the importance of documentation. So a duty to act is a legal requirement to respond to and care for somebody who's ill or injured. This particularly applies to professional care providers such as EMTs and paramedics. In the wilderness setting, the duty to act may apply to you, especially if you are a designated leader and responsible for managing others in your group. So in other words, let's say you're a team leader and a member of your team is injured. It is your duty, and it is your duty to maintain their safety and to assist and make sure that they're taken care of. Consent is permission from an ill or injured person to provide help. You cannot act without that. Every adult has the right to refuse treatment. Every adult has the right to refuse treatment. Consent is best obtained by clearly and calmly identifying yourself and the fact that you're trained to help. Always ask a responsive person if he or she wants help before providing care. When someone is unresponsive or incapable of making an appropriate decision, consent for you to help is legally implied. So if they are unconscious, or if they are not in their right mind, then you have permission to help them. Implied consent assumes a person or legal guardian would agree to be helped given the circumstances. The use of implied consent often applies to children and adults with cognitive disabilities. So if they're a special needs adult and they can't make the decision for themselves, you have permission to help them. The level and degree of treatment you are trained to provide can be recognized as a scope of practice. So what that means is you can't go beyond your scope of practice. You can't perform surgery. You can't put in a tracheotomy unless you're taught to do that. If you attempt any treatments that are beyond those covered in your training, you may have exceeded the scope and practice and put yourself at legal risk. Once you begin care, you must remain with the ill or injured person until someone with equal or greater training takes over. So, that is important information. You cannot leave them once you start until somebody takes over for you. Leaving someone alone to get professional help is an exception to the legal abandonment. Return to the person as soon as you can. All right, we got Good Samaritan laws. Good Samaritan laws, they protect us from being sued as a result of incorrectly performing first aid in an emergency. In almost every case, this fear is unwarranted. So, as long as you are doing your best and you're not exceeding the scope of your training, even if things don't go great, you're doing the best you can and you're protected. All states in the United States have passed Good Samaritan laws to encourage bystanders to assist those in need. So, they help protect anyone who voluntarily provides assistance, is reasonable and prudent, does not provide care beyond the training received, and is not grossly negligent in delivering emergency care. So those are the things that you need to have in the back of your head. So if you volunteer, that it's there to help you, but you have to be reasonable and prudent, and don't exceed your scope, and don't grossly cause more harm than good. Common sense. So regardless of the situation, it's always appropriate to use common sense. Introduce yourself and state your level of training. Ask a responsive person for permission to give care. Avoid using skills that exceed your training. And once started, don't stop until someone relieves you. All right, documentation. So, what laws protect bystanders who provide first aid care from being sued? The answer, of course, is Good Samaritan laws. And they're good all through the United States, and as long as you're reasonable and prudent, and you don't exceed your scope, and you don't cause any more, you're not grossly negligent, then you're protected. Knowing how to activate and get advanced medical resources, especially in a remote setting, is fundamental to providing effective first aid care. The sooner you can get them on the way, the better. So getting help after completing this lesson, you should be able to state or identify the following: how to activate professional help for a wilderness emergency in situations that require an evacuation versus a rapid evacuation. Evacuation decision. In a remote location, always assume that an ill or injured person's condition could deteriorate. In a remote location, you have to think about how long is it going to take for them to get there. What's going to happen while you're waiting. So you're going to be there for a while. Make the best decision you can based on the information you have from what the subject is dealing with. When in doubt, make immediate plans to evacuate. Waiting and seeing if a situation improves can be dangerous. So, do you go fast or do you go slow? The first decision to make is the degree of effort to get made to get a person to professional help. So that's going to depend on how serious you think the problem is. So go fast means you'll make every effort possible to reduce the time it takes to get a person to professional medical care. Situations that require you to go fast involve problems that require professional help as soon as possible to prevent long-term disability or death. Go slow means you can manage a person's medical condition but may extend the time it takes to get professional medical care. Situations in which you can go more slowly involve problems that can be managed for a length of time with supportive care. So some things to consider are: what resources are available? Is the person able to walk safely? Can the problem be managed in place? And how accessible is the current location? What's the weather conditions? What resources are available nearby? So how do you access professional help? EMS describes the pre-hospital emergency medical system developed to respond to medical emergencies within a community. In a remote or wilderness area, EMS response times can be much longer. Nearly everyone has a mobile phone, but in remote locations that may not be able to get signal to call for help. Fortunately, as mobile phone services expand, more and more remote areas are gaining coverage. Mobile phone services delivered in a line-of-sight manner. If you can't get a signal, consider sending another person quickly to a location that is higher or nearer to where service may be available. Activating EMS usually consists of calling an easy-to-remember number such as 911. When you connect, a trained dispatcher will guide you through the call. A dispatcher will ask for basic information such as the type of emergency, location, and what care is being provided. Answer questions clearly and concisely as you can. Most importantly, provide as much detail as possible on your location and how to access it. So if you can access what your latitude and longitude or your USNG coordinates are, those are great because that will pinpoint you down to within a few meters. When professional rescuers are responding, try to maintain communication with the dispatcher until they arrive. Follow any directions they give you. It's helpful to take steps to signal responding rescue personnel to indicate your exact location. So you might want to, they've got a flare in the picture here, but you might want to have a fire or some flagging or something to indicate that this is where you are, especially if you're near a trail or something and they're going to, they're coming up the trail. Consider carrying electronic signal devices like flares or mirrors to help rescue people find you. They don't require cell signal or batteries. When there's no risk of accidental fire, spread a smoky signal fire or accidental fire spread. A smoky signal fire can help others find you. When they're searching by air spell out messages in rocks or branches on the open ground. The decision to mount a search and rescue effort may be made because you are missing. So this is talking about written trip plans right now, and the more detailed written trip plans you have, the better. And if you leave them with a point of contact back home, that will help. So if you leave a written or electronic description of your trip with family members, when the call comes in for help, or if you're overdue, the search and rescue people can have an idea of where to start looking. So what they want is details and map about the route you're taking, starting point, day and time, expected times to be at locations along your route, expected return time and date. So what I normally do is I draw it up where I've got where I'm starting, where I'm stopping each day, and I try to put the coordinates for each of those on there so that if they needed to check in and they know, okay, he should have been at this point at this time. So arrange for a specific time to check in. If you do not, a person you left plans with can notify authorities. So what that means is if you tell somebody that you're going to check in at 5 o'clock in the evening, you need to check in at 5 o'clock in the evening, not at 6 or 7, because if you want them to be concerned when you're delayed. You don't want them to think, oh, they just got sidetracked and they'll call me later. Evacuation is the act of getting an affected person out of a remote area and to professional medical care. So the way you're going to evacuate depends on the medical problem, the go fast, go slow decision, and the resources available. So here you see she's helping him hobble out. Evacuation should always be done as soon as possible once the decision to do so is made. Just don't sit around and wait for things to get worse. It's easiest and quickest to assist a person to self-evacuate, meaning if they can move on their own and you can help them, great. So here's a picture of an assisted evacuation. If the person can't walk, they may have to be carried out. So, so she's getting a piggyback ride from this guy. That's not going to be fun for anybody, but they're going to get her the help that they need, that she needs. Other than self-evacuation, the next fastest approach to evacuation is for others in the group to carry a person out. So here they are, they're carrying her out. This increases the risk of additional injury to the person and to those involved in the effort. So if you stay in place, evacuation can also be accomplished by staying in place and waiting for rescuers to arrive. So here they're showing you a helicopter to indicate a helicopter evac. If you are in a go fast situation, do your best to help responding rescue personnel get to you as quickly as possible. So you're providing care to an injured person in your hiking party. You've taken all relevant factors into consideration and still can't decide whether or not to evacuate. What should you do? When in doubt, make immediate plans to evacuate the person. Waiting to see if a situation improves can be dangerous. All right, moving and lifting. When it's necessary to move someone who is ill or injured, a first aid provider must know how to do it safely and effectively. You should know the importance of proper lifting and moving of ill or injured people. You should be able to demonstrate a one rescuer roll from back to side, side to back, and face down to back. 2 to 3 rescuer roll from back to side, side to back, and face down to back. You should be able to demonstrate body elevation and movement technique and placing a person into a recovery position. It's best to move the person on. It's best not to move the person at all unless they're clearly in danger and require life-supporting care. The concern in moving a seriously injured person is the chance of making the problem, such as a spine injury, worse. There are situations in which moving or repositioning someone is clearly necessary. If there's immediate danger, if the position the person is in prevents effective assessment and treatment, the person's airway becomes blocked, or the person needs to be moved a short distance to be protected. Emergency moves emphasize protecting yourself and the person from injury and keeping the person's head, neck, and torso aligned. All right, pay attention to basic body mechanics. Know your physical ability and respect your limitations. Don't hurt yourself trying to save somebody else. Make sure that you're in a stable position without risk of losing balance. Keep your back straight and avoid twisting your body. Establish and keep physical control of the person. When lifting, always flex at the hips and bend at the knees, not at the waist. Keep the person's weight close to you so that you're not reaching out. You're going to communicate. You need to communicate effectively so that all members know exactly what's happening at any given time. Designate a single person to guide the actions. That, for our purposes, is going to be the person that's designated as the medic, and that would be the person that would be supporting the head. They're going to this is typically the person responsible for maintaining control of the person's head and neck. Okay, so somebody needs to be in charge, and in this case, it's going to be the medic. All right, the most effective way to move someone out of harm's way is to use a quick emergency drag, and here he's doing that by grabbing the shoulders of the guy's jacket and dragging him. Pull in the direction of the long axis and keep the body and spine in line. Never pull on the person's head or pull the body sideways. Okay. So the clothing drag, just like what you saw in that other picture, is so he's going to grab a handful of the guy's shirt at the shoulders with each hand and pull away from the hazard. So you want to keep him in a straight line, leading with the head and trailing with the feet. Keep it as straight as possible. As the shirt rides up, it supports the head and neck like a hammock. The blanket drag was probably going to be the easiest if you have a blanket or a tarp available. You log roll the person onto it, and then you can drag the tarp, and it's still going to be tough, but it'll slide over the ground easier. His belt and pants and things won't snag on the debris. The extremity drag, you can do a drag by pulling the arms as shown in the picture. So here they're showing you a log roll, which you guys already know how to do. Note that he's got his hands at the shoulder and at the hip area, and she's supporting the spine. So this could be used to do a blood sweep down the back. It could be to put him in a rescue position, or the rescue position. It could be to get a tarp under him. There's a variety of reasons why you might want to do that. You want to keep him face up as much as you can. It can be done quickly in an emergency, or it can be done in a more controlled manner during assessment and care. So you could use this to clear the airway, get a person onto a blanket, to inspect the back, to place a pad underneath the person. So just everything I had already told you. It's preferable to perform the log roll with multiple providers, but a single provider can perform it as well. So you position yourself. So kneel next to the person's torso, allow room for the person to roll towards you, and if needed, slowly and gently bring the person's head in line with the body, bring the person's arms in close to the sides. If possible, cross the person's ankles. Okay, place one hand on the side of the person's head for support, and grab the far arm near the elbow and compress tightly into the side. Okay, and so he's cupping her head with his right hand, and with his left hand he's pressing her arm into her hip. And then what he's doing is he's rolling her towards him. He's using his right arm to support her head and keep it in line, and so he's getting her onto her side. So he's lifting and supporting that head because it's going to drop to the, it's heavy, so it's going to drop to her left side when he rolls her. All right, so those are just re-showing you the 4 steps that we talked about. So position yourselves. One provider above the head to support the head during the roll. The second, this is with a 2-person or multi-person. The second person positions just like the 1-person log roll. So he's getting his knees out around near the torso area. He's bringing the guy's arm in close to his side. The difference is going to be he's bringing the arm into the side, can cross the legs, and then here in the picture show that he's got his right arm at the guy's shoulder and his other arm trapping the arm in about the hip level, so that, and then he can quickly and smoothly roll the guy onto his side. Okay, so there he is rolled onto his side, and there they are. There's all 4 steps together. Okay, a beam move. So the body elevation and movement technique can be used to move a person a short distance or to lift a person to get something underneath him or her. So how do you do this? It requires enough providers to effectively and safely accomplish the desired move. So here they've got 5 providers. So step 1, you position yourselves. You got 2 near the thighs and knee area, and you got 2 up in the torso and shoulder area, and 1 at the head. Okay. Slowly and gently bring the head in line with the body if that's a problem, and then bring the person's arms close to their sides, or in this case, they've got them up and crossed. Okay. Manually support the person's head with both hands. The other providers gently slide arms underneath to support the torso, legs, and arms and legs. Providers' hands should be staggered with providers' hands from the opposite sides, so they're not linking hands; they're staggering. So now they lifted her up, but they're on their knees, ready to do whatever they need. So there's all 4 together. So putting the person in the recovery position, you do that log roll. You can put her left arm out so she can rest her head on that, and then you may need to move legs to keep her from rolling back over. Okay, frequently assess for breathing issues while she's in the recovery position. They could quickly become worse and need additional care. So how are we going to do this? So step 1, bend her left knee up and get her right arm over her shoulder, or across her chest and over her shoulder, and her left. I'm sorry, that's her right knee and her right arm, and then her left arm is out, extended over her head. Okay, and now you're going to do the roll. So you're at the shoulder and the hips, just like you would with a log roll. Okay, and you're going to roll her to the point where she's almost face down, but she's resting on her arms. All right, and there are those 3 steps. We're going to talk more about documentation in the next PowerPoint presentation, but documentation is crucial, not only for the subject, but it helps you as well to document that these are the steps that you did. So if it did go to court, there would be a record of that. So it creates a good legal record, but it also helps to make sure that you are that you communicate effectively to the professional medical people when they arrive. A common adage to documentation to describe the importance of documentation is, if it wasn't documented, it never happened. So write it down. So to be prepared for any legal or medical follow-up, write detailed notes. Preferably use a templated medical care report form. So we have a form for ESAR. There's also a form called SOAP notes that you can use as well.